in 20, 25 minutes.
Okay, so this is it's a presentation I gave a couple of months ago now about how the council reacted to COVID, and it's a little bit about my personal experience. It's a bit about how the council changed, and it's a bit about, at the time, it's about how this needed to be a catalyst for change. Now I've kind of updated it a little bit because we have kind of got a bit of an outcome of how we're going to change as an authority, so I'm going to share that with you at the end. So the message we really want to get across is that digital is really seen as the only answer through this. Collaboration and how that transformed the way we work. The importance of data, and our data was critical in everything we've done, and I think that's really really been demonstrated across the organisation now, how important it is to get real-time data, especially when we're working with something like COVID. A little bit on our dream team and how my digital team changed just before COVID happened. And the last bit, previously it was about code, and digital has to be a catalyst for change, and now I'm just going to explain very quickly what that change is looking like for us as a council. So, as we all remember, the lockdown started on the 23rd of March, and a new normal started very quickly. What was incredible for the authority is how quickly we all moved and jumped onto Teams with a digital platform. It was something we'd been using as a team for a little while, but literally overnight, the entire council just lifted and shifted onto this new platform. It was brilliant. And it became brilliant for doing digital processes really, really, really quickly. So we were getting asked to build stuff in a couple of days like other councils were. And it was great to use Teams because we could just call on the people we needed to. We could build a minimal viable product in a few hours, share, collaborate, iterate. So it's really, really great how it all came together. And how my team changed a bit. A couple of weeks before the lockdown started, we had a couple of senior developers in IT that were asked to go back to work within the IT department. So I had 5 developers, suddenly I had 3. So it's quite a challenge. But we managed to pick and pull a few other people across the organisation that weren't developers, and that made a real change into the way we design and build stuff. So I'll explain a bit about that as we go through. This just shows how my office life really changed. So I think this was the second Thursday of lockdown. My wife works on the NHS supply lanes chain, so she had to work upstairs in a contact centre at home, really, managing PPE. So I was left looking after the 2 children. So suddenly I've gone from an office to sitting on a kitchen table surrounded by paint and everything else that the kids needed to keep them occupied. But also, we were very lucky. We've got an allotment, and allotment was allowed to be used as part of the exercise rules through lockdown. So it was getting a bit tricky after a few weeks at home with the 2 kids running around and screaming while I was trying to do meetings. So one day it was nice and sunny, so I just took my allotment, took my laptop, took my phone, connected my laptop to my phone to do work. The kids had a lovely day. They spent 5 or 6 hours just making mud pies and playing around the allotment and destroying all my seedlings. Probably one of my busiest days when I was trying to manage all the digital stuff, but it was so productive because I could just easily connect with everybody, share screens, and I was very much working with developers and business areas to try and get a product together. So it just demonstrates how you wouldn't really have dreamed 6 months ago I'd be spending a working day sat on my allotment with 2 kids, but actually it worked brilliantly well. So looking very quickly at Teams, what was interesting was we started a project in 2008 called Flexibility, and that was about rolling Teams out across the organisation. And as you can imagine, that was a project where we had planned it all out. We'd started to engage with a number of teams, and there was a kind of phased approach to working with teams to get and service areas to get them onto Teams across the council. In February, we were having about 12 meetings a day. By May, we were having 686 meetings a day. In February, there was about 3,200 messages being sent a day on Teams. By May, there was 45,000 messages being sent a day. And it just shows how quickly people adapted to that. So that whole plan about moving people onto a team platform and doing all that work and having champions within teams to help support this, it just disappeared, and everybody just suddenly overnight jumped onto the Teams platform, and it made a massive difference to the way we worked. So what followed, it was quite quiet for the first couple of weeks, and I remember talking to my team saying when lockdown started, okay, things are going to get busy now, but actually it's very quiet for a couple of weeks, and it's a bit strange. But then suddenly a whole load of stuff started coming our way. So we were asked to launch what we call a golden number. So this would allow residents to phone us if they needed any help. We asked to design a I need help process, which we've had about 2,600 requests for help now. And that again is kind of around the I need prescriptions or I need food. We built a food parcel service process, so people could buy food parcels, or if people needed help in the community, our neighbourhood officers could just log onto there and arrange to get a free parcel sent out to residents. We had what we called a 500 list and an e-health list. So this was about contacting about 11,000 residents that we knew had been identified as shielding or had been identified as slightly at risk from their GPs. And we wanted to contact them all to make sure they were well, they had the help that they needed. And we made about 23,000 calls so far. We've just used all the data that we've had from those processes. We've captured bits about the customer. Have you got friends that can help you? Are you able to leave the house? Have you got the internet? And what we've done in the last few weeks is we've had a brilliant analyst who's mashed all that data together and came back with about 2,600 residents that we needed to help through the pandemic. So now we've phoned all those people back. We know shielding is ending, so we've been in touch with them all just to say, do you need any help? We know you've helped you in the past. The government support's ending, but these are local areas or local facilities that you might be able to help you in the future if you need it. We built 2 business grant application forms, and we had about 7,000 applications through those. We built an adult social care recruitment process. We had about 850 applicants in the first 3 weeks through that. And we built a PPE process, a full digital process, which I'll explain. So I'm picking on a couple of these, which is a 500 list and the PPE, and I'll show you very quickly what we did with those. So this was our I need help form. So either an NDO, a neighbourhood district officer, or a customer can go on here and they could just say, I need some help with some food or prescriptions or utilities. And we started capturing a little bit of information about the customer as well. So if they were shielding, if they were over 70, and that all helped us understand that citizen a little bit more. We had 99.9% of those requests were really genuine people who really needed help. They were really struggling. But I've just picked on a few here, which were probably not quite so urgent. So we had one case when we were delivering a food parcel to a resident and we'd phone them to see where they were. But this person managed to nip out to the shop to get some cigarettes, which was make you think she probably could leave the house. We had another lady who was really worried that she'd had the same lottery tickets for 20 years and she'd never missed them. But now her neighbour couldn't get to the newsagent for her and she's panicking her numbers would come up. So could we go and get her lottery tickets for her? And we had another lady who wanted her dog walking because she was shielding, but it was an expensive dog and she didn't want to have anyone else take it out. What she didn't realise was that she could go in the garden. So when our NDO said, have you got a secure garden? Can you throw a ball? And she said, yeah. She was really pleased and said, I'll go outside now, start playing ball with my dog. So there's a few light-hearted ones, but 99% of the cases that we came across were people that really needed some help. Food parcel service. The key to all these processes we built is we built them really, really quickly and really, really simply. So a customer could go online here. I need a mixed food box, a vegan box or a halal box. Do you want a standard box or a family box? And it's really simple to go through, take the payment for it. And that then came straight down into our leisure centre. And they would literally print out the label on the left, attach it to a box. The box would go down the leisure centre, get packed with all the essential foods. A taxi or some services would be waiting outside. The boxes would go into the truck with the label on the front and they get delivered out around the community. So that's worked really, really well. And it's a really simple process. Picking on a couple I mentioned before, so the 5,000 list and the e-health scope. So what we were asked to do was within a few days, design a process to contact initially 11,000 residents. We'd got the data from the government, so we knew who we needed to contact. And we needed a process to display the customer details, who they were, what their phone numbers were, what their address were. NHS number was critical because we used that to map everybody together. And we needed to mobilise a contact centre to make all those phone calls. We managed to build the whole process in about 4 days, and it was just before Easter. And then over the Easter weekend, we made 7,000 calls. We made 23,000 calls altogether through that process. What we were doing with that is when we were calling residents, we made 3 attempts to get hold of them and phone them. And if after 3 attempts we couldn't get hold of them, we used the data then to inform our community protection team to go knocking on doors. Within the first week, it showed how valuable that was when we knocked on a resident's door and we found the gentleman in the house had collapsed on the floor downstairs. His wife had dementia and was upstairs in her bedroom. So very quickly, everybody involved in this realised how important it was, and that's a really good example of how using the data, feeding it out into community protection, going knocking on the doors really made a difference to some people. We also had about 1,300 people that hadn't realised they could register on the government website to receive help. So again, we tagged all those customers, and then we had another team that went off and actually went onto the government website and registered all those users on there, so they started receiving food parcels. And I just mentioned we've just finished this week the recalls. So that's the calls to another 2,600 residents that we identified as people that we'd helped in the past, and they might need a bit more help, or we might need to signpost them out to different areas of the community going forward. The second process I'm going to touch on quickly is PPE. So we were asked to have a quick look at what was happening around PPE provisions, and what we found, which is quite common with councils, that there was a paper-based process in place. So a business could go onto the website, they could download a paper application form, that would have to be emailed in. We had a triage person who would look at what they were requesting as PPE. She'd check her spreadsheets to see whether we had the items in stock or not. If it was in stock, she'd scan it, she'd send it down to a team at a leisure centre. They would pack the items up. They would then contact the customer, tell them it's ready. The customer would turn up, they'd have to wet signature, bring ID to say that they'd collected their PPE. And at the end of every night, all those pieces of paper then all scanned back together and sent back up to the team involved, and they would go through all the orders that had gone out and manually update all their spreadsheets. So it became quite an onerous task for everybody, and it wasn't very reliable. And we also found that we had an issue with a few batches of faulty PPE that had come in, and we didn't really know where that had gone. So it's difficult to try and go through lots of paperwork to try and look at who might have received that PPE and try and recall it. So we built a new stock control database. We built a whole PPE solution in about 3 weeks. And again, key to this was the data. So all that reporting, all the government reports that were being done, it was now all going to be managed through Power BI and through dashboards. So I'll show you very quickly what that looked like. So here's our process that we built. So a customer goes online and orders their PPE. That came down to a triage team, and they check the order. And in this solution, what we started doing is looking at the PPE stock tables that we had. So when a triage person was looking at what the customer was ordering, if it was face masks, they could see how many we've got in stock. If it was sanitizer, how much we've got in stock of different volumes, and they could tweak the order around based on what was available. If they were unsure about anything, particularly masks, they could press a button and it would go through to a senior public health officer who could make that decision for them. When the order got approved, it went down to the packing team. So they had their iPads and they got a ping on their iPad. They got a new case and they could go around and they could pack the order of PPE. When they closed their stage, the customer got their email to confirm their collection was ready. And they just had to turn up then with their collection reference number. There was no signatures, no paperwork. And it just made the whole process much more streamlined, much more efficient. From the key of this was the data, and so what we built is a whole load of dashboards within Power BI. So our procurement team or our team managing the PPE could come onto this dashboard, and there's about 12 altogether now. I'm just going to show you a couple. So you could, on this one, you can select any item we've got. So disposable aprons, when stock comes in, you can see when it came in, and as stock starts going out, you can see where we are with each item. We built procurement a dashboard that showed all the stock we had, and using the data, we analysed what our burn rate was over 7 days, and we looked at our burn rate over 14 days, and then we started flagging on here in red and amber if stock was starting to run low. So if we thought we got about 3 days stock left at the current burn rates, we've got a red flag. If there's about 3 to 7 days, we've got an amber flag. And that means our procurement team can quickly look at this dashboard, look at where we need to get PPE and try and procure that if they could do. And this was what we built for managing recalls. Now this was when we were doing our test data, but ultimately when they were packing items, they would put in the batch number off a box. So if there ever was a recall, we could load this dashboard up, we could pick on a batch number, and that would show us exactly where it was, when it was booked, which organisation took it, what they took, and the contact details. So we could quite easily get in touch with that organisation and say, we need to recall this PPE, have you used it or not? We could also work out what PPE had been left within the warehouse. We knew where it was. So it made it really quick and really easy to be able to identify anything that we need to recall. Channel shift. It rocketed really when COVID hit. I mean, we've always done really well as an authority on channel shift. So blue is online and red is contact centre calls we get. It's actually a lot higher than this. We haven't built in a couple of the processes we did yet into the data, but we're hitting 85% of customers coming online and about 15% contacting us on the phone, even though the contact centre was fully functional and fully working. It's pretty much maintained that. I mean, it's always been about 70%. We're still hovering around the 80% mark. So it really has shown that customers have been really keen and really willing to go online. They always have been with us, but they've done it more since COVID happened. So what I was trying to get across in this quickly was, it was different for us as an organisation. We've pushed digital a lot, but when it came from the senior leadership at the very top, saying we need a digital process, we need a way to contact residents to record outcomes, we need a process for business grants, and we want it in 2 days or 3 days. It really, really changed the way the organisation worked, and it really brought people together. So what would probably take weeks in the old ways of working with meetings was happening literally in hours. We had a process for business grants, so it's very quickly, okay, conference call with all the key players. Let's quickly just drag and drop a process and a form together to look at the data you need to capture. My guys would then go away, work on that a bit more, start building all the clever stuff they do and all the integration work they have to do. And then we'd be back on a call a few hours later with some senior managers around the organisation saying, okay, is this the way you envisaged it to work? And it just completely transformed the way we worked. We'd never have been able to deliver what we delivered as quickly as we did without that way of working together. And Teams was critical for that. The data, I think that's really, the organisation's really noticed how important data is now. And everything we did was about data and real-time data. So the PPE process is brilliant with all those real-time dashboards capturing stuff. Everything's automatically updated. There's no more manually creating government returns. Procurement teams going straight in at any time and looking at what PPE we've got and what's starting to run low. So the data has been critical for us throughout this. When I mentioned about our dream team, what we did, kind of silos came down a lot through COVID. So what we had was we were able to pinch a couple of people across the organisation, and the key people were a couple of data analysts. So we were building stuff and they were building the Power BI dashboards behind it, and it made a great way of working. So my developers were building stuff, the analysts were looking at the data, trying to build the dashboards, and it made a really good way to test systems as we built, because we'd be building something, going back to the analyst saying, okay, we've added this bit in there, can you build that into a dashboard? And they might come back and say, oh, well, it doesn't look quite right here, something's a bit of a mismatch, and they come back to us and we go, oh, well, okay, we've missed a token or something in the design. So it really, really worked really, really well, and everybody worked fantastically well. It was incredible how the teams came together, and across the organisation, you could grab people when you needed them, pull them in together to work. So the loss of our 2 developers to IT didn't really impact on us hugely. We still delivered everything we needed to. And then COVID, previously I talked about how it'd have to be a catalyst to change. Personally, I don't spend half an hour driving to the nearest tram stop and then spend half an hour on a tram in congested traffic. You look at the green emissions and all this kind of thing. So I briefly talked last time about how COVID should be a catalyst for change. Well, we're kind of working through that now. So we've got a project that's just being kind of finalised at the moment. They're happy for me to share this, but what we're looking at really is a rationalisation and utilisation of council offices and stock to greater reflect the future needs of the workforce and improve services. So we've got a lot of buildings around the city, and I guess like many businesses and probably many councils, we're really starting to say, actually, do we need all these buildings now? We're looking at generating organisational transformation and culture change to improve productivity and well-being. We're looking at better use of technology. So technology and digital has really really come under the spotlight across the council, and it's seen now as the only answer. We're going to identify services and roles that may work remotely with permanence. So we're very keen at looking at this being a new norm now. Going forward, if there is a team that can work from home, we're going to encourage that to work from home. And we're going to modernise the council services to maximise efficiency and channel shift for all our customers. So what we're really saying here is we're looking at the teams that we've got around the organisation. Can my team come in? Can we remove some of these paper printing processes across the organisation? Can we get more people to work from home? Can we build the processes we need to make that happen? And that's really going to be our model for going forward and how we're going to change as an organisation.